what kind of standards would you look for from the government versus just let us alone and eventually healthcare, we will work it out?
Okay, so I come from the reddest state in the nation, which is Utah. And I mentioned earlier, I'm pretty conservative. I have to tell you though, when I go back to DC and I talk standards, I think the government needs to define data standards so that we can get to a level where it is truly fluid data that's moving between the systems and it means something. Even using FHIR and some of the API work that we've been talking about, and frankly, we've been using for quite a while and pushing here at Intermountain, it doesn't get to a level of specificity where you really have this fluidity of data and where it can be used and computed. So what we'll do is we will get more data into the hands of the consumer, which is good. There's nothing wrong with that at all. We'll get the ability to shift data between systems or health systems or hospitals, but it won't be readily computable. So either we're going to have to go through some pretty challenging work to get that normalized into the system so that it can be consumed by the computer and provide insight that our clinicians are looking for, or I think they're just not going to look at a lot of it. And it's likely to be the latter. They're not going to look at a lot of it. It's funny, and you can stop me whenever, Bill, but probably 5 years ago, I went out and I did 23andMe. I was going to go out and get to some of this precision medicine, and I was going to understand more about my DNA. And I went and I did it, and it wasn't all that insightful. Took it to my physician. He didn't even want to look at it. He didn't even care. And it's because it's not relevant to what they're trying to accomplish. We're giving physicians, 8 minutes on average to deal with a patient. They don't have time to consume this stuff. It has to be brought to them in a meaningful way. And so I'm a big proponent of the government being much more aggressive in defining standards and putting them out there for us.